Hello everyone, my name is Sylvia McClem and my presentation is on SLE, which stands for Systemic Lupus Erythematosus, also known as simply lupus. So, what is lupus? Lupus is a chronic autoimmune disease that can damage any part of the body, whether it is the skin, the joints, and or organs. Autoimmunity means your immune system cannot tell the difference between foreign invaders and your body's healthy tissue. These foreign invaders can be in the form of bacteria or a virus, etc. As a result, it creates autoantibodies that attack and destroy healthy tissue. These autoantibodies cause inflammation, pain, and damage in various parts of the body. Although some people with lupus have only mild symptoms, the disease is lifelong and can become quite severe. It can also lead to other conditions that are life-threatening. There are 4 types of lupus. There is drug-induced lupus, discoid lupus, which is cutaneous, neonatal lupus, and then there's SLE. Each type can be identified by its unique skin rash that forms. SLE is the most commonly reported form of lupus, affecting different organs around your body. This type of lupus may actually not produce a rash, since it affects the internal organs. SLE can also cause a condition called lupus nephritis, where your kidneys begin to suffer damage and can eventually shut down. If SLE causes inflammation of the nervous system and your brain, then there would be memory loss, confusion, headaches, and it could lead to a stroke. Inflammation of the brain's blood vessels can cause high fevers, seizures, and behavioral changes. And if SLE affects the arteries, coronary artery disease can develop and can lead to a heart attack. There is not a definite cause of lupus. There are 3 factors that are being researched to try and find that cause. Regarding hormones, because 9 of every 10 occurrences of lupus are in females, researchers are now focusing on the differences of men and women, even beyond the hormone levels, which may account for why women are more prone to lupus and other autoimmune diseases. In genetics, researchers have now identified more than 50 genes which they associate with lupus. While these genes have not been shown to directly cause lupus, they are believed to contribute to it. And in the environment, researchers today think that there are certain agents, such as viruses, and one commonly cited factor is ultraviolet light, UVA and UVB, or the exposure to silica dust in agricultural or industrial settings that are believed to trigger lupus or at least be the cause of flare-ups. Some common symptoms in people with lupus, whether they be men or women, are extreme fatigue, headaches, painful or swollen joints, fever, anemia, either low numbers of hemoglobin or low total blood volume, edema in the feet, legs, hands, and or around the eyes, pleurisy, that butterfly-shaped rash across the cheeks and nose, photosensitivity, hair loss, abnormal blood clotting, Raynaud's phenomenon, which is when fingers turn white or blue when they're cold, and mouth and nose ulcers. Some final facts to consider regarding lupus. First and foremost, lupus is not contagious. You cannot catch lupus from someone. And although we mentioned that it predominantly affects women of a certain age, men, children, and teenagers can and do develop lupus. It is estimated that about 1.5 million Americans have lupus, and unfortunately, when we speak on a global level, that number does increase to about 5 million people that have some form of lupus.